My name is Abby,
I'm Shannon.
And I'm Allison.
and we're going to talk about light therapy for the treatment of seasonal affective disorder. A general definition of seasonal affective disorder, or SAD, is a chronic disorder with predictable onset of depressive symptoms in the early fall or early winter time and remission in the springtime. The Diagnostic and Statistical Manual of Mental Disorders, DSM, defines SAD as a regular temporal relationship between the onset of major depressive episodes in bipolar I or bipolar II disorder or major depressive disorder recurrent in a particular time of the year. Do not include cases which there is an obvious effect of seasonal related psychosocial stressors, such as regularly being unemployed every winter. B. Full remissions or a change from depression to mania or hypomania also occur at a characteristic time of the year. C. In the last 2 years, 2 major depressive episodes have occurred that demonstrate the temporal seasonal relationship defined in criteria A and B, and no non-seasonal major depressive episodes have occurred during that same period. Seasonal major depressive episodes, as described above, substantially outnumber the non-seasonal major depressive episodes that may have occurred over the individual's lifetime.
Typical symptoms of seasonal affective disorder include depressed mood, loss of energy, carbohydrate cravings, hypersomnia, hyperphagia, weight gain, and significant impairment in social and/or occupational functioning. Onset of SAD typically occurs in patients 20 to 30 years old, is more common in women, and is prevalent in about 0.4 to 2.7% of the populations of the United States and Canada. However, due to a large variety of measurement techniques used, exact and accurate data are not available. Suggested mechanisms for the development of SAD include pituitary gland size and function, melatonin dysfunction, and circadian rhythm shifts. The pituitary gland regulates the production of melatonin, which helps regulate sleep. Because the sun regulates pituitary gland function, when the amount of daylight decreases, such as in the wintertime, the pituitary gland may not be producing the right amount of melatonin in some people. Circadian rhythm shifts will be discussed shortly. Treatment methods for SAD include light therapy, dawn simulators, ion generators, antidepressants, L-tryptophan, St. John's wort, and exercise.
The traditional mode of delivery for bright light treatment of SAD is a light box, commonly fluorescent white light, that is often heavy, bulky, can be awkward to use, and requires a longer period of time per day using the machine than the newer models. Newer machines used for light therapy are light-emitting diodes, LEDs, that are more compact and are more efficient than fluorescent and incandescent light boxes. The human circadian rhythm system is most sensitive to light with wavelength and range from 450 to 480 nanometers. LEDs can be selected to emit light with energy concentrated in this range, while fluorescent and incandescent sources emit across the visible spectrum. Patients use the devices by simply sitting and facing the device. Some studies still use 1 hour or 2 hour light therapy treatment durations, but 30 minutes is increasingly becoming accepted as the minimum duration of treatment. The circadian rhythm timing system is most likely to shift with light therapy in the morning hours when melatonin levels are increased. Common side effects of bright light therapy can include jitteriness, headache, eye irritation, fatigue, or increased appetite. These side effects are very minimal, especially compared to antidepressant medications, which typically take 4 to 6 weeks for clinical improvement of SAD symptoms, while light therapy typically begins relieving symptoms within 1 week. Go Light LED lights average about $169 when purchased online at sites such as eBay.com.
The Hamilton Depression Rating Scale is a very common tool used by clinicians to determine whether a person is depressed and the severity of that depression. The questionnaire contains 17 to 21 categories that refer to symptoms of depression experienced over a span of a week. Questions are based around the following symptoms in which the patients rates each on a scale from 0 to 4: depressed mood, guilt, suicide, insomnia, work and interests, retardation, agitation, anxiety somatic, somatic symptoms gastrointestinal, general somatic symptoms, genital symptoms, hypochondriasis, and loss of weight. The score results in scores that range from 0 to 53, where a score of 0 to 7 is considered normal and a score above 20 is usually required for entry into a clinical trial.
The first article we're going to discuss is Lux versus Wavelength in Light Treatment of Seasonal Affective Disorder. This study was a randomized, double-blind trial in which participants were issued either a blue light-emitting diode or broadband blue-enriched white LED. It was a 3-week trial and conducted at 2 different sites. 33 adults ages 18 to 64 years old with SAD were participated in the study, but 13 participants were excluded from the data for various reasons. Clinicians provided each participant with light treatment device and instructions for use. Each participant had a 45-minute session of light exposure each morning between 6 and 9 a.m. The approach used to evaluate the data was the intent to treat approach. They analyzed the data using hierarchical linear modeling and Pearson chi-square tests that utilize t-tests and ANOVA tests. They also used the 17-item Hamilton Depression Rating Scale that was described earlier. Baseline depression among the participants was moderate. The depression severity scores decreased in both groups in both treatment methods. All responders showed greater than or equal to 82% improvement. Rates of improvement were comparable for both light sources, at a decrease by 4.4 per week from the mean baseline of 27.5 on the Hamilton scale. There was no difference found between the 2 treatments. We gave this article a B, grade of a B, because there was a small number of participants, and there was also no placebo or non-treatment group for comparison. It was, however, randomized and double-blind. However, and it did also use the LED and the Hamilton Depression Rating Scale.
The second article we'll discuss is titled A Controlled Trial of the Lightbook Light Emitting Diode Light Therapy Device for Treatment of Seasonal Affective Disorder. This study was multi-site, randomized, double-blind, and a parallel group clinical trial. It was conducted at 5 different sites where the participants were between the ages of 18 and 65 and diagnosed with SAD. The participants were issued either a Lightbook light-emitting diode from 464 to 564 nanometers or placebo inactivated ion generator. The patients were instructed to sit 20 inches from the light, and the treatment lasted 30 minutes daily after waking up and prior to 8 a.m. The Hamilton Depression Rating Scale scores were used as baseline. The data was analyzed using a ANOVA mixed model with Hamilton Depression Rating Scale as the dependent variable. 23 participants were included in the results, 14 in active treatment and 9 in the control. The mean HDRS scores for the active and control groups had little difference at baseline. The HDRS scores improved in both groups over the 4 weeks of treatment, but the active treatment showed the greatest improvement. The proportion of participants achieving remission was significantly greater in the active treatment group compared to the placebo, 57.1% versus 11.1%. These results show that the active treatment is superior to the placebo control. We gave this paper a grade of A because it used LED lights and the Hamilton Depression Rating Scale, was a double-blind and randomized clinical trial. compared a treatment to a placebo where there was significant difference between treatments. However, there was still a small number of participants.
The third article we will discuss is called A Light Therapy for Seasonal Affective Disorder with Blue Narrowband Light-Emitting Diodes. This was a 3-week parallel randomized double-blind trial, and it used short and long wavelengths of LED lights. The short wavelengths were 468 nanometers and reflected a blue light. The long wavelengths were 654 nanometers and they reflected a red light. 30 participants with major depression with seasonal pattern were participating in this trial. They had a score of greater than or equal to 20 on the Hamilton Depression Rating Scale. Patients were randomly assigned to the LED light treatment. They are also randomly assigned to a 3-week outpatient treatment period where they received the light therapy for 45 minutes daily between 6 and 8 a.m. They are instructed to sit directly in front of the light, 50 centimeters from their eyes, and they are to glance briefly at it every minute. The SAS system with ANCOVA was used to analyze the data, and baseline data using Hamilton Depression Rating Scale score was also used. HDRS was used weekly on participants, and the clinician was blind to the treatment that the participants were receiving. Remission of symptoms was defined as a decreased HDRS score by greater than or equal to 50% to a score of less than or equal to 8. This study resulted in 24 patients completing the trial. 4 patients in each group were taking antidepressants. 11 completed the light treatment with the blue LED, and 13 completed the light treatment with the red LED. Baseline mean HDRS for the blue LED was 7.3 points lower than that for the red LED. 55% of patients using the blue light remitted, while only 31% of the patients using the red light remitted. No subjects reported any side effects to the treatment, but this was not formally assessed. We decided to grade this paper a B+ because yet again it had a small number of participants. It did not formally assess the side effects, but it did use the LED light treatment in Hamilton Depression Rating Scale and was a randomized double-blind trial.
We decided on an average grade of an A- for the 3 articles. All 3 studies found that light treatment using LED lights is effective for the treatment of SAD as defined by the Hamilton Depression Rating Scale. Also because all 3 studies showed improvement from baseline symptoms throughout each trial. However, the placebo or non-treatment groups were inconsistent.
We gave the treatment of light therapy for SAD an overall level of evidence of 2. The reasons we determined this were that the studies were of strong design for the question with minor methodological concerns. The findings were generally consistent in direction and size of effect or degree of association. They were several studies by independent investigators. We had some doubts about the adequacy of sample size to avoid type 1 and type 2 error. The studied outcome related directly to the question, and there were minor doubts about generalizability. If you are suffering from seasonal affective disorder as diagnosed by your doctor, LED light therapy may be a good option for your treatment. Some of the studies have been done to help patients with SAD show that light therapy has positive benefits in helping to lessen the symptoms of SAD, such as depression. The side effects are minimal and include jitteriness, headache, fatigue, increased appetite, and eye irritation.
These are our references. Thank you!